Welcome back to the deep dive. We're here to cut through the noise and really get to the heart of things. And today we're diving into something really fascinating, but also, pretty high stakes in the world of horses' newborn foals. Specifically, those situations where maybe after months of waiting, a foal arrives, either weeks too early or maybe right on time, but just not quite ready for the world outside. So our mission today is to unpack all of that. We want to demystify these situations. We'll look at the key differences between what vets call premature and dysmature foals. Why do these happen? What are the big hurdles these little guys face? And importantly, the incredible, really intensive vet care that gives them a fighting chance. This deep dive should give you some shortcuts to understanding these critical distinctions, maybe some surprising facts about how they develop, and just the sheer commitment needed for these vulnerable newborns. Okay, let's get into it. So maybe first, to really get a handle on these differences, we need a baseline. Like what's actually considered normal for a foal's arrival. For a mare, average gestation is about 340 days.
But normal foaling, well, it can happen anywhere between, say, 320 and 360 days. That 40-day window, it seems wide, but it's actually super important for understanding this first category, right?
It's absolutely the critical piece of information, that gestational age. If a foal is born before that 320-day arc, well, that's premature. Simple as that. Doesn't matter how big or small they are at birth, if they come out before 320 days, they're premature. The core problem is just not enough time inside. The organs, the systems, they haven't fully developed or matured. Think of it like taking a cake out of the oven way too early. It just hasn't finished baking.
Okay, premature equals too early, less than 320 days.
Yeah.
Got it. But this is where it gets really interesting because you contrast that with something that sounds similar, looks similar, but is actually different dysmaturity.
Exactly. And what's fascinating really is how these two different starting points can lead to foals that look so much alike when they're born. A dysmature foal, now, that one is born at or near term. So inside that normal 300 and 360-day window. But here's the catch. Even though they're chronologically on time, they show those physical signs we associate with being premature. It's like their biological development just lagged behind, even though they had the full gestation time. There was some failure in normal maturation in utero. So the key takeaway really is that while they might look alike, knowing when they were born tells us fundamentally different things about their development, and that guides how we approach them.
Okay, so we have foals that arrive too soon, premature, and foals that arrive on time but aren't quite finished cooking yet, as you put it, dysmature. Let's dig into the why now. Why do these things happen? Because presumably the underlying causes are often different too.
Precisely. For prematurity, it's usually a reaction to some kind of problem inside the uterus, something that compromises the environment for the foal. It basically forces the mare's body to start labor early. By far, the most common cause we see is placentitis.
Cosentitis, that's inflammation of the placenta.
Exactly. An inflammation or even an infection of the placenta, which is, the foal's lifeline in there. If the placenta isn't working right, it stresses the foal, stresses the mare, and often triggers early birth. Other things, too, like if the mare gets really sick with colic or another serious illness, twin pregnancies can do it, the uterus just gets too stretched. Or red bag delivery, where the placenta detaches too soon.
Oh, right. Heard of those.
Yeah. And less commonly, things like too much fluid buildup around the foal, or fescutoxicosis, that's from grazing certain grasses. It can mess with the placenta. Sometimes inducing birth too early can cause it. And other times, well, honestly, sometimes we just don't find a specific cause. It's idiopathic.
That makes sense. The body's kind of hitting the emergency eject button because something's wrong right now.
Yeah.
So dysmaturity then, that points to more of a slow burn, a chronic issue.
Exactly right. Dysmaturity almost always signals a chronic problem inside the uterus, something that's been hindering the foal's growth and development over a longer time. Think of it like a long-term restriction on nutrients or oxygen getting through. Key causes would be, chronic placental insufficiency. Maybe a low-grade placentitis that doesn't trigger labor but just slowly makes the placenta less efficient.
Okay.
Or chronic uterine disease in the mare herself. Severe malnutrition or long illness in the mare could potentially contribute, though less common with good management. There are rare genetic factors, too. And fescutoxicosis, again, that's actually a classic cause of dysmaturity, often leading to a thickened placenta that doesn't transfer nutrients well.
Interesting. It can cause both.
It can, depending on how it affects the placenta and the mare. Rarely may be a problem with the umbilical cord limiting flow over time. But if you step back, both conditions often boil down to some form of uteroplacental insufficiency, basically. The supply line isn't working optimally. Also, any major stressor, fetal or maternal, can kind of push the foal's stress hormone system, the HPA axis, into maturing too early, which can contribute to either picture.
Okay, so the why can be quite different. But what's really striking, as you said, is how similar these foals can look and act when they're born.
Hmm.
So what does that mean for the foal itself? What are we actually seeing?
Yeah, for the foal, it means they show widespread signs of just immaturity. Their organ systems aren't ready, whether they came early or just didn't develop fully on time. They're often small, low birth weight, frequently under, say, 40 kilos or around 88 pounds. You'll notice their coat looks wrong, very fine, silky hair, maybe lacking those coarser guard hairs, especially around the muzzle. Their ears can be floppy, the cartilage is soft, and their head might look a bit domed because the skull bones haven't fully hardened yet.
So physically, they just look underdeveloped. What about how they behave, how they function?
Well, functionally, they're typically weak, lethargic. They often have a poor suckle reflex, which is a big problem right away. They struggle to stand up, and when they do, their movements can be really uncoordinated. And critically, this is a major concern. They often have flexural limb deformities. Their joints aren't quite right, maybe too lax or too contracted. And crucially, those small cuboidal bones in their knees and hocks the carpus and tarsus are often incompletely ossified. They haven't turned fully to bone yet.
Ah, okay. That sounds serious.
It is because it affects their ability to bear weight. Then there's breathing. Respiratory distress is super common. Their lungs are immature. They lack surfactant. That's the substance that helps the tiny air sacs inflate easily.
Right.
So you might hear them grunting, making sort of roaring sounds with effort. They also can't regulate their body temperature well at all. And digestive issues, their gut motility is poor, meaning things don't move through properly. And they struggle to absorb that vital first milk, the colostrum.
Wow, it sounds like basically every single system is fighting an uphill battle.
Yeah.
Are there particular systems that are like the biggest immediate worries?
That's a good way to put it, an uphill battle. Their immune system is a huge concern. It's underdeveloped, and they often fail to get enough antibodies from the mare's colostrum. We call that failure of passive transfer, or FPT. That makes them incredibly susceptible to infections. Sepsis is a major risk.
Sepsis, yeah. Bad news.
Very bad news. Neurologically, many seem dummy or disoriented because their central nervous system isn't fully mature. Some might have a patent urachus, that tube from the bladder to the umbilical cord hasn't closed, so urine leaks from their navel. We also see kidney issues, trouble filtering waste. The gut, besides poor motility, is at risk for serious inflammation like necrotizing enterocolitis. Their whole metabolic system can be unstable, blood sugar swings, hormone regulation problems, and then the neuromuscular weakness we mentioned, sometimes linked to oxygen deprivation around birth that we call PAS or HIE. Even their cardiovascular system can be unstable, prone to collapse, and might not respond predictably to drugs we use to support blood pressure. It's like a whole cascade of problems stemming from that core immaturity requires constant watching.
It's absolutely clear that both premature and dysmature foals are immediately in the high-risk category. They need help, fast and intensive. So what does the diagnostic process look like when one of these fragile foals arrives? And then for the owners listening, what does this intensive care actually involve? What's the reality for them?
Right. The first diagnostic step is trying to differentiate premature from dysmature, and that absolutely hinges on knowing the precise gestational age. Breeding dates, ovulation dates become crucial. Then, obviously, a thorough physical exam, noting all those clinical signs we just talked about. But imaging is essential for both. X-rays, radiographs of the carpus and tarsus, the knees and hocks are critical. We need to see how well those cuboidal bones have ossified, how much bone is actually there. That's a huge indicator of maturity and tells us how careful we need to be about exercise to avoid crushing those soft bones.
Right, crushing the bones. That sounds awful.
It is. It can lead to permanent lameness. We might also take chest X-rays to get a better look at the lungs.
Okay, so X-rays are key for the bones. What about blood tests? What are you looking for there?
Blood work is comprehensive. We run a CBC and chemistry panel looking for signs of infection, dehydration, checking organ function like kidneys and liver. We absolutely measure IgG levels to check for that failure of passive transfer. Did they get enough antibodies? Blood gas analysis is vital to assess their oxygen levels and acid-base balance. Lactate levels tell us about tissue oxygenation. High lactate suggests problems. We also look at other things, like the ratio of certain white blood cells or even the size of their red blood cells. Believe it or not, some of these numbers can actually give us clues about their prognosis.
Okay, so a lot of information gathering up front. Then comes the care. For owners, what does that NICU stay really look like?
Well, it often means the foal needs to be in a specialized neonatal intensive care unit, the NICU. It's intensive in every sense. First priority is making sure they get colostrum. If they can't suckle effectively, we'll tube feed it. If their IgG is low despite colostrum, they'll need IV plasma transfusion.
Okay, getting those antibodies in is job one.
Absolutely. Then respiratory support. Many need oxygen, maybe through nasal cannulas. Some, the more severe ones, might need a ventilator to breathe for them. We can even give surfactant directly into their lungs. Thermoregulation is constant keeping them warm. They lose heat so easily. So heat lamps, heated blankets, sometimes even specialized incubators.
Got it. Warmth, oxygen, antibodies. What about feeding them if they can't nurse well?
Good question. Nutritional support is critical. We often start with feeding mare's milk via a nasogastric tube, small amounts frequently. If their gut really isn't working well, they might need intravenous nutrition, either partial, supplementing milk, or total parenteral nutrition, TPN, where all nutrition is given IV.
Wow, IV feeding.
Yeah, it's complex, but sometimes necessary. Sepsis management is huge. Because the risk is so high, we often start broad-spectrum antibiotics right away, even before confirming an infection. Strict hygiene is paramount, constant monitoring for any sign of trouble. And the limbs, if those cuboidal bones aren't ossified on X-ray, exercise must be absolutely restricted. Strict stall rest, maybe just brief, supported standing.
To avoid crushing them.
Exactly. We repeat the x-rays periodically until we see enough ossification. We might use splints or special bandages for limb deformities. Interestingly, once there's some bone, very controlled, supervised, gentle exercise can actually help stimulate further ossification, but it's a very fine line. Beyond that, it's intensive nursing care, keeping them clean, dry, on deep bedding, helping them stay upright, or repositioning them frequently, careful fluid therapy so we don't overload their systems, and supportive care for any neurological issues or that patent urachus if it's present. It's a lot. Round the clock.
It sounds incredibly demanding, but also like there's a clear plan for tackling each problem. Given all that fragility, all that intensive care, what is the road ahead? What's the actual prognosis for these foals?
That's the big question, isn't it? The prognosis is generally described as guarded. It's highly variable. It really depends on how immature they are, how severe their specific clinical signs are. Profound weakness, severe breathing problems, major neuroscience, those make the outlook tougher. And certainly the presence of major complications like sepsis that gets out of control or severe brain injury from lack of oxygen, HIE, or those really bad cuboidal bone crush injuries, those significantly worsen the prognosis. However, and this is really important, the quality of veterinary care is a massive factor. Immediate, intensive, skilled neonatal care dramatically improves survival rates. It makes a world of difference. And here's something that might surprise you. Despite how fragile they are, many of these foals, particularly those that are maybe borderline or respond well to initial treatment, with dedicated intensive care, survival rates can actually be quite high. We're talking maybe 80–85% in some referral centers.
Wow, 80–85%. That's much higher than I might have guessed.
It is. And what's more, many of them can go on to have perfectly productive lives, even successful athletic careers. It really underscores the value of getting them that expert help immediately. Now, sure, there can be potential long-term issues, maybe some lingering organ dysfunction, chronic respiratory issues, conformational problems from the limb issues, effects of sepsis, but overall, the outcome for large numbers is remarkably positive. Oh, and for prevention, if a mare has one of these foals, she's definitely considered higher risk next time. A thorough reproductive checkup before rebreeding is wise, and her next pregnancy should be monitored very closely.
That's actually incredibly hopeful, that 80–85% figure. This whole discussion has been so insightful. We've really peeled back the layers on the critical differences between prematurity and dysmaturity, subtle but so important. We've seen the shared challenges they face, how widespread the effects of immaturity are, and just the sheer dedication and skill required from vet teams to pull these tiny foals through. It's really quite something to think that despite starting out so vulnerable, so many not only survive but actually thrive. Makes you think. Considering the incredible intensity, the resources, the financial and emotional commitment needed for these neonates, what does that tell us about the value we place on every single life, even the smallest, most fragile ones that need so much help just to get started? Something to ponder. Thank you so much for joining us on this deep dive today. Keep exploring, keep asking questions, and keep appreciating the amazing complexities all around us.